Good morning. I'm Matt Schwartz, Chair of the Mayor's Healthy Hometown Worksite Wellness Committee. I'm here with Randy Schrodt, who is a integrative psychiatrist, and we just finished a great session talking about the impact of mental health on employers. And so, Randy, maybe share with us just kind of the quickie background on what you talked about in terms of the prevalence and why that has such an impact on employers.
Well, statistics have pretty much confirmed that diagnosable psychiatric or substance abuse disorders affects at least 1 in 4 Americans at all age groups. It may be a little higher in the geriatric population because you begin to get some of the neurocognitive issues combined, but whether it's childhood, adolescence, adulthood, about 1 in 4. So there's very few, if any, individuals that either themselves or a close family member has not been affected in some way by psychiatric disorders. Secondly, unfortunately, for a variety of reasons, only a small percentage of individuals actually receive treatment for this disorder. So this contributes to the fact that it's overall one of the leading causes of disability, and from particularly a workplace standpoint, depression is the number one loss of productivity and disability within a business setting.
And we also talked briefly about the concept of kind of cost, and the fact that you may see in a lot of employers the number 1, 2, or 3 prescription volume is on antidepressive or that type of medication. It may not be the highest cost, but we talked about a little bit about how that impact. What's that trade-off, and how does that play out for an employer? Why should this be a priority?
Well, and I think you're exactly right. It's the old joke of somebody down on the ground under a street lamp, and what are you doing? And I'm looking for my lost ring, and oh, you dropped it here. It's like, no, I dropped it over here, but here's where the light is. I think that from a business perspective, it's easy to take a look at the costs out of it. What does the treatment cost? What do the medications cost? What's not included in those formulas are the cost offsets. For instance, the disability, or in the case of psychiatric illnesses, how it really causes medical expenses to blow up. For example, among individuals with depression, their annual medical expenditures, not counting psychiatric, are twice the average. So folks who have psychiatric illnesses, particularly anxiety, depression, don't feel well, they utilize medical services, often spinning their wheels, getting what turn out to be unnecessary tests because of a failure to recognize and get somebody to the appropriate treatment. When we have systems that can really capture all of that data, the economic advantages of accurate diagnosis and treatment are well established. Beyond a happier and generally healthier workforce, in fact, the costs decrease.
Right, and you talked about the correlation between, you talked about if you go into a records room and you look for the thick files, that's going to be the person who not only has a lot of other diagnoses, but probably has some mental illness. So what is that, what should an employer do about that? What are the things, we talked a little bit about preventive and the path that an employer should take.
I think most things start with awareness. I think as I had asked you, we've been doing Mayor's Healthy Hometown for 2 years, and today we're getting around to talking about the mental health aspect of it, and I don't think that's peculiar. Usually when people sit out around a table, they begin to take a look at what are the issues within the workplace, or even when people start to talk about looking at it as a medical system. It's not a new phenomenon that the mental health and psychiatric aspects of it are often bounce back, in spite of the fact, if you look at the numbers, it ought to almost be the first thing that you take a look at, not just those disorders themselves, but, for instance, 84% of the overall U.S. medical expenditures have to do with chronic illness, heart disease, diabetes. We'll even leave the psychiatric side of it out. But often what complicates those is the concurrence of depression. It's very clear that a diabetic who has clinical depression is going to fare differently and in the area of oncology, in the area of pain management, in the area of cardiovascular disease. It's not just because it's the right thing to do or that it's a nice thing to do, even if you were being just purely mercenary about it. If you really want to cut costs, you're going to have to address the mental and psychiatric aspects of what's going on.
And then the final point, the thing I was going to bring up is one of the comments from, we had a nurse in the audience who's talking about the ability to integrate and kind of lead somebody to a path and have I guess an open workplace where they're going to be able to resolve their issues without it distracting from their job. So just maybe a moment on that.
Well, I think it begins with beyond enlightenment. I think it's the development of a culture, I think part of that is in the body of people that are going to be out there, accessible and effective in terms of really helping. Now, maybe some people really do just need to exercise or meditate, but very often there really is a problem the worker is having or someone in their family and it's affecting them. And they don't know what to do, or their attempts to access treatment for themselves or somebody else are hindered by a variety of other problems that we talked about. And so to have an advocate, I guess if you will, almost a navigator of sorts, that's going to help somebody get the appropriate level of care, I think could be critical.
Excellent. Well, it was a great session. We appreciate you doing that, and we appreciate those that came this morning. If you missed, we're here virtually every month at Baptist East Milestone, and we look forward to seeing you at the next session.